Perfect. So, since you are here, I mean, one of the challenges that I really see, and I want to ask you about, talking about the effect of weight, the weight on these like lymphedema, lipedema stuff. Since so many patients, they are really having an issue with high BMI, and then they have these issues. So I know I always tell the patient you have to lose weight, but I think having an expert wisdom regarding this topic will be also enlightful.
Right, so you have to understand the main reason of the disease, the pathology, especially lipedema, is a symptom that's generated from abnormal accumulation of fat that causes chronic inflammation, and chronic inflammation causes pain, and that's what lipedema is about. So if the more fat you have, the more chronic inflammation you have, the more pain you have. And second, there's a limit to what we can surgically remove. So in order to have the ideal outcome after surgery, the most important thing is that the patient has to be prepared to a certain level where the removal of fat can be beneficial.
Yeah.
So there's a lot of article, and basically it shows that a cutoff of BMI less than 30 shows to be more effective.
Nice.
I'm not saying that over 30, should not be it should not be indicated. I'm just saying it's more effective.
Yeah.
And it takes less trials of surgery to get the right result.
Yeah.
So I think losing weight in that sense is a critical part of the treatment. And the same thing for lymphedema. The more fat you have, the more storage for fluid you have. And we've actually published a paper looking at the cutoff of how much weight is the most effective in treating lymphedema, and it also turns out to be BMI of 30.
30, yes.
So losing weight and decreasing that storage of fat, I think, is a critical component in the treatment.
Nice.
For lymphedema as well. And third, for me, when the patient loses weight, it shows that the patient is willing to try. The treatment for lymphedema or lipedema is teamwork.
Yeah.
The surgeons cannot, perform miracles. And it's very important that the patient complies with compression, complies with manual drainage, and most of all, lose weight.
Yeah.
And this actually shows that the patient is willing to do what it takes to get that result, especially in terms of compliance.
Yeah, exactly. So I always tell my patients when they come and visit, try to lose weight, try to build muscle, try to do the aggressive conservative therapy, and they are not convinced. They come to us and then they say, okay, this is fat. Why should I do lymphatic massage and lymphatic drainage and the compression bandage? And there is a big relationship between the lipedema fat and the lymphatic system. So what do you think about this, and how can like any word of wisdom also to be shared regarding this point?
Well, absolutely. Chronic inflammation causes fluid retention, ultimately may lead to pain as well. So by draining out the fluid, reducing the inflammation, we believe that the manual lymphatic drainage and compression helps to reduce the pain related with lipedema. So I think although we need more scientific evidence in the future, but for now, that our understanding is that it will help the patient, but it is not a definitive treatment.
Yeah.
Again, the definitive treatment is losing weight and performing surgery.
Yeah.
But in order to live a better quality of life, especially in daily activities or daily life, I think that really helps them to reduce a certain amount of pain that they're suffering.
Nice. And I think lifestyle, they have to like changing lifestyle, improving healthier habits. I noticed that there is a big improvement in these aspects, and then they will become more prepared. And since we are on the same topic of lipedema, so many patients are asking why we investigate, why we do like nuclear imaging or ICG or ultrasound. So in my practice, usually when I see the patients, I ask for lymphoscintigraphy, ICG lymphography, and then ultrasound, Doppler for DVT study, and Dopplex for varicose veins. So some patients, they are not convinced to do these imagings, but they are very essential. So what do you think about this?
Well, there's many factors that I think should be considered. I mean, let's just start off with cosmetic liposuction, for example. The patient doesn't have lipedema, just regular fat, and the patient undergoes liposuction. And unfortunately, we see so many complications from regular liposuction that leads to lymphedema.
Yes.
And why is that? Because they injure the lymphatic system.
Yeah.
But even when normal patients undergoing liposuction has a chance to have injured lymphatics, in lipedema patients, 5% of the lipedema patients have very weak lymphatic system. And by knowing through investigation what is the current status of the lymphatic system for that lipedema patient plays a very important role in designing how you want to do the surgery.
Yeah.
Lipedema surgery is not just simple liposuction. So it has to be prepared accordingly. And if you have a risk for lymphedema, then you have to avoid getting the lymphatic injury as much as possible. And this is why investigation is important. And second, in cases where lipedema is conjoined with lymphedema, we need to treat them both.
Yeah.
You need to treat lipedema, you need to treat lymphedema. And like I said, 5% has this kind of combined type. So understanding the disease, understanding the risks is critical in having a good outcome.
Yeah. Like unfortunately, most of the patients, they think it's just like do a liposuction and that's it. And some surgeons, they do this approach without any preparatory courses, no pre-op like compression courses or investigations, which is really alarming. And we really here in Saudi, we suffer. And I personally have so many patients who have secondary lymphedema after liposuction. And when I ask the patient, do you have any investigations pre-op? Majority, they say, oh, no, I don't. So I always advise, like, before you do anything, just investigate and then try the conservative, then go when you are ready for surgery. What do you think about this approach?
Well, you know, this is a very important question, and it's very unfortunate that even in med school today, they're not taught about lymphatic disease.
Yeah.
They're not taught about lymphatic anatomy, lymphatic physiology, and not to even mention the concept of lymphatic disease. So most of the surgeons in our generation are not really accustomed to the idea that a special set of knowledge and skill is needed to address this problem.
Yeah.
And this is why, unfortunately, there's so much complications involved in just doing liposuction without investigation and not addressing it properly as it needs to be. And hopefully with you coming back from Korea, learning the knowledge of lymphatic disease, lymphatic surgery, now hopefully you'll be able to educate your peers, and hopefully the peers will be able to practice in the right way.
Yes, in the safe
but I
way.
think for the patient's perspective, it's very important that they know what their conditions are. I mean, if you go to a surgeon, even me or you, and patient comes in and says, oh, I think I have lipedema. I mean, even though my experience, will say most likely you'll have lipedema, without proper investigation, I would not know what risks you have, what underlying symptoms you have, and I would not be able to do an accurate diagnosis.
Yeah.
I mean, if for example, if you want to go buy a purse, you're going to ask what brand it is, what size it is, what is the inside, what is the outside, what is the price, is it from 25 to 24?
Yeah.
And so you're going to be examining this very carefully. The same thing with our body. Without the right proper examination, we don't know. And this is why getting the right knowledge, getting the right surgeon with the right knowledge and skills is critical in having a good result. And I hope that with you now here, we'll be able to educate more of our peers. And this is not only a problem in Saudi, but this is a problem worldwide.
Yeah, exactly. I mean, since we are talking like worldwide, and you are currently the president of the World Society of Reconstructive Microsurgery, and I know that your schedule is so full, traveling around, educating, and sharing your wisdom and knowledge. So, is the situation we have here in Saudi is the same in other countries, or are we on the map? Are we beyond or far behind? So, what do you think?
Well, like I said, there are 300 million patients just with lymphedema. And especially in the Middle East, your body style is more prone to disease of lipedema. So there's a very high incidence of that as well. And like I said, it's been less than 2 decades that we really start to understand what lymphatic disease is all about. So I would not say that you're necessarily too late. But I would say that you have a lot of work to do. You being a pioneer in this field, in this region, you have a lot of work. And I think this is an ongoing study, ongoing field, and we're starting to figure out more and more. But nevertheless, even with the knowledge we have, that may not be a significant amount, we're still able to help the patients very, very much.
Yeah.
And hopefully this will change over the years. Now we're starting to understand that, it's not only about lipedema, it's not only about lymphedema, but chylothorax, Crohn's disease, protein-losing enteropathy, even dementia, venous ulcer is also part of a lymphatic disease spectrum. So this is a developing field. But for now, I think we need to address lipedema and lymphedema properly.
Yeah.
And I do believe we have enough knowledge and skills to address that.
Yes.
And hopefully the patients will meet the right surgeons who has that knowledge and skills.
That's really insightful, and it's really helpful to focus on these points. Since we are on the same topic, and as it is related to the patients and the patient insights and role in this journey, one of the struggles I really face here in Saudi is the compliance on compression. Most of the patients, they lose belief in the compression, or they use a compression for, I don't know, same stocking for 2 years, like what we saw in this visit. And then they have the false belief that this stocking is not working. So what do you think about this major challenge?
Well, compliance is always a big issue.
Yeah.
And I think the compliance being the big issue, I think one of the main reasons for that is that, to be very blunt, there is no cure.
Yeah.
There is no cure for lymphedema. This is a lifelong disease. You need to be ready as a patient to address this problem lifelong.
Yes.
The symptoms may improve quite a bit, but there's always a chance of recurrence. If you have a severe cold, if you get some kind of trauma, it could recur. If you gain weight, it could recur. So this is a lifelong a disease that you need to manage. And this is why a lot of people, they just give up.
Yeah.
They just give up. But unfortunate truth is, if you give up, the chances of you suffering from recurrent infection ultimately may lead to cancer and even amputation. So this is something very, very devastating, not to mention the daily poor quality of life. The good news is that you can control it.
Yeah.
And compliance is the key. Compliance in losing weight, keeping a good diet, compliance in compression, compliance in lymphatic massage, the drainage. This is important. So you must understand, with the guidance of your physician or your surgeon, keeping this compliance is the key. So the patient must accept you can make it better,
Yeah.
but only if you try.
Yeah.
And this is the key. If you're not going to try, the surgeons, we're not God, unfortunately. We cannot make it go away.
Yeah.
This is teamwork. It's your body. You have to take care of your body. We are assistant to your body.
Yeah.
So ultimately, we need to solve this problem together. And the first more thing is, it's your body. You have to take control. And in a way, you may say, wow, this is a curse. But you know, I see it differently. In a way, it's a blessing for you. We talked about this,
Yeah.
to find a healthy lifestyle. Can you imagine? I mean, your BMI was 30 and then you're able to reduce the BMI to 24 and maintain 24? Think about all the benefits.
Yeah.
The reduction of heart disease, the reduction of diabetes. You must take this opportunity. Although you have this disease, take the opportunity to become healthy, change the lifestyle, enjoy the rest of your life. And we see so much success stories.
Yeah.
With the guidance of the right surgeon, we see so much success stories. So don't give up. Comply with your surgeon. Comply with your dietitian. Comply with your physiotherapist.
Yeah.
And you could get that win. And you could live even better than the normal people around you.
Oh, that's really amazing and really insightful, and really it shed light and focus onto this very important aspect in the treatment plan. So since we are talking about the compliance, I mentioned it like at the end of my question, and I think we saw one of our patients wearing the same stockings for 2 years.
Yes.
And I always tell the patient, please, it's not like one stocking for lifelong. You might need to change the size, you might need to change the brand. Some of the stockings might not fit you from the first trial, but you have to use the proper stockings. One problem that I face here in Saudi, most of the patients, they go and they buy the stockings from the pharmacy, or they go and buy stockings from online shops without proper fitting and without proper sizing, and sometimes they don't know what is the size or the degree of the compression. So here comes our role and our colleagues in our team in the physical therapy to orchestrate the treatment plan. So yeah, I mean, this is a very important point.
I completely agree. And again, I understand the frustration of the patients. It's like diabetes. If you have diabetes, you give insulin shots every day. But still, even though you know how to manage and give insulin shots, you still go see your doctor every 6 months.
Yeah.
To see whether or not your overall blood control is okay, the HbA1c is okay. You go see your physician.
Yeah.
Same thing with lymphedema and lipedema. You must go see a professional like you, Dr. Ferris, and talk with them every 6 months.
Yeah.
And see if your compression is fitting well. Because it's a cloth, and if you wear the cloth for a long time, it wears out.
Yeah.
It loses its strength. And see if it's still fitting, see if you have a good diet plan, if you're controlling your weight. So you must follow up with a professional every 6 months, like a diabetes, even though you're controlling well.
Exactly.
And see, and see if everything is going well. So serial follow-up is very important. And during the serial follow-up, addressing these issues such as compliance, physiotherapy, diet, body habits, these are all important factors.
Yes, it's totally important. And many of the patients they ask about the new drugs that manage like obesity and its effect on lipedema and lymphedema. So of course I understand, and I have to focus that we are not privileged to prescribe these medications, but we know the implications of these medications on the disease that we are handling, like lipedema and lymphedema. So what do you think about those medications and their role, like the GLP-1 medications?
I think it's a heaven sent. I mean, nowadays the patients are so lucky to have this kind of drug choice. In the past, there was no drug choice. They all had to resort to gastric bypass, surgical maneuvers to reduce weight. But now with these miracle drugs, I really think it's a miracle drug, they're able to lose a lot of weight. But unfortunately, despite the fact that you're losing weight with these incredible drugs, they still need a surgical treatment to manage the part that's not being handled despite this miracle drugs. So you're absolutely right. You need to go see your dietitian. You need to go see your endocrinologist. You need to go see your specialist who manages this in these kind of prescription, because everybody's different. Not a single drug is a fix for everybody. The dosage is different. So you need to go speak with your specialist. But you must also let your lymphedema surgeon know that you're on this.
Yeah.
And then you're losing weight, you're trying, you're controlling. So I think it's an essential part of the treatment. And please go speak with your specialist in regards to losing weight.
Yeah.
And most of all, let your surgeons who are handling your lymphedema, lipedema problems know what you're doing.
Yeah, exactly. Since we are talking about medications and drugs and those kind of things, one of the struggles that here in Saudi I face is from the false knowledge on social media. I can recall like a couple of weeks ago, I scheduled a patient for ICG lymphography, and she was a lipedema patient. And when I checked her liver enzyme, I found it sky high. And then I asked her, I told her, you told me that you are medically free, you don't have any issues. Are you taking any medication? She said, yeah, I'm taking some supplements I found it in TikTok, and I tried to use it. Then I told her, stop. When she stopped, and I sent her to our colleagues in internal medicine just to double check, and it was a toxicity effect from the supplements. So this is a very important, challenging point here we face. So I'm sure that you had the same problem in South Korea. So
right.
What do you think?
Well, I think internet, the knowledge on the web, could be a very powerful tool for the patients to learn about their condition, learn about their disease. It even educates us professionals on what is the latest evidence behind the treatment. But I think what's most important is that you cannot take it as a fact of what's going on the web. Unfortunately, there's a lot of false knowledge. Unfortunately, there's a lot of fake messages to promote their product, which is not proven. So you must have the ability to filter and make sure that you read more than just a single site. You cross-reference, you read more, you try to learn more. And if you still have doubts before you go on and self-medication, you talk with your professional, get their opinion, and see what works or what doesn't. So I think in a way, the internet is a great source for you to learn, but you must learn in multiple references. Make sure that you're cross-checking and do your due diligence in learning about your condition. And if you have doubts, then you talk with your specialist. And this is why we're here. I mean, obviously, we go to med school for 6-8 years, and then we train in plastic surgery, 6-7 years. And we are, after a few years of clinical expertise, we are here. So although the internet is an incredible source of knowledge, sometimes the experience that the surgeons have add on to that knowledge and gives you the best course. So don't be afraid to make consultations. Don't be afraid to ask intelligent questions, and don't be afraid to accept what you don't want to hear as well. Learning is about knowing the good, also knowing the bad. So be informative. Do your due diligence in every part of learning about your disease.
Nice. So I think we spent lots of talks about generality of lymphedema and lipedema and the main important aspects in managing and the struggles that we face here. I want to just focus on the couple of minutes that we have on lymphedema. So since we were glad to have you here, we had a couple of days with many clinics, and we saw together a spectrum of lymphedema patients. So we saw patients with primary lymphedema, like congenital, and we saw patients with secondary lymphedema. Internationally, breast cancer is the leading cause, or cancer in general is the leading cause of secondary lymphedema. Here we also have post-aesthetic surgery lymphedema, like the patient we saw post-brachioplasty after she did an aesthetic surgery, post-thigh lift, and after she did thigh lift and aesthetic surgery, they developed lymphedema. So are we on the same map internationally? The figures are. Is this something like local or this is something international? We don't know.
Well,
what do you think?
Yeah, I mean, this is a very good question. Unfortunately, if you look at the most of the statistics, 95% are secondary lymphedema. So the definition of secondary lymphedema is it's secondary for a specific cause. So, like for example, cancer, or you do aesthetic surgery, they on purposely or accidentally cut the lymphatic drainage, and the fluid accumulates in your leg or arm, causing enlargement and swelling of your leg and arm, which is lymphedema. When it's secondary, at least we know what the problem is, and we're able to address the problem, whether it be intentional or not intentional, whether it be after cancer, a lymph node resection, or by accidentally from aesthetic surgery. We know what the cause is. And the secondary lymphedema in that sense is a little bit more easier to treat and also have better outcome. But primary lymphedema, which is around average of 5%, is more difficult to treat because it's an internal problem of the lymphatics itself. So even though we create a shunt, sometimes the outcome may not be favorable. Then the question is, how can the outcome be favorable? Is that you need to be diagnosed early before the lymphatics starts to get more injured for degeneration. So earlier the better. And I think this is where the role of educating the peers is so important, that the physicians, the pediatricians consult lymphedema surgeons like you and see if we can solve or at least help these patients with primary lymphedema. And this is the reason why, because of the lymphatic degeneration itself, the outcome is much worse than the secondary lymphedema. Unfortunately, in secondary lymphedema, in our practice, 85 to 90% will benefit in reduction of volume and actually in improving symptoms. However, in primary lymphedema, our statistics show only around 50 to maybe, if you're lucky, 70% will improve. And this is why you must go see the physician if you think it's primary lymphedema. Now remember, primary lymphedema is defined as lymphedema without a cause. So it could be born with it, or it could happen when you're 45 years, you woke up in the morning and suddenly your leg is swollen. These are considered primary lymphedema. Yeah. And you must go see Dr. Faris, specialist like Dr. Faris, and address this problem. Now, one thing that is very unfortunate about and very specific to your region is that there is a higher incidence of primary lymphedema in Saudi and the Middle East. So it's very important that, again, you see and address these problems as soon as possible. Now, we saw a patient yesterday. She was an 8-year-old patient, and unfortunately, it seemed to me that she might have primary lymphedema, and we could see that her leg is already hard, stiff, and it makes the treatment much difficult. Yeah. If she had come when she was 2 years old, it would have made a complete different story. So I think it's very important that the people know what is primary lymphedema, and also the fact that it's difficult to treat, but if you come early, you have a much better chance in having a better outcome.
Yeah. And you just mentioned that we have to be very clear with the patient that for lymphedema, there is no cure. But
that is correct.
There is a treatment. So
that is
there
correct.
Is a huge difference between a cure and treatment. Cure, meaning it returns 100% to the normal, but treatment meaning we control the disease.
Correct.
We control the sequel of the disease, and we maintain the disease itself. So in the same notes, some patient they come and most of our patients here, unfortunately they come late. We would love to have the patient come early, and the challenges are from peers by not referring early, saying that and telling patient there is no hope, there is nothing, there is no treatment for it. But there is, as I mentioned, there is a very huge difference. But by saying there is no cure and there is no treatment, no treatment means that don't do anything, which is wrong. And So I would like to have like a word of wisdom from you in this matter as well.
Yeah, so the bottom line is, we have to do better. We have to do better. We have to go out there and educate our peers, especially gynecology, breast cancer surgeons, even pediatricians, urology. We have to educate them more. And I think we are doing this as much as we can. But I think now we have to go to the level in addition of educating our peers. This is what we're doing. We're trying to educate you, the people, the patients themselves, and hopefully that you'll be able to educate your gynecologist, your urologist, your pediatrician, and ask them, hey, is this a lymphatic disease? And have you educate them in return. They refer the patients to the right people.
Yeah.
So I think this is a whole education of not only our peers, but the patients, and hopefully a lot of patients and families will be able to see this and understand that even the scientific community, unfortunately, is in the process of just learning. Remember, this is only 2 decades of practice that we have. So we're still in a very early period. And you cannot blame other surgeons, other doctors for not knowing, because it's relatively new knowledge. Yeah. And this is why you as a patient, you as a family member of a patient must educate yourselves and also try to find the nearest expert around you.
That's really really important. And one question, we were asked this question like yesterday and the day before yesterday, when we counsel patients for the surgical option, and then we explain those like treatment versus cure and everything. So one question was, why should I do the surgery, and what will happen if I keep using the stockings, although they've been using the stocking for a couple of years, for 2 years, and there's no improvement. So why we do surgery versus why we continue on compression, or we don't do anything. So I remember you answered that question frankly, so I would like to share the same answer as well.
Right, this is a very important question, and we get this question a lot. So, I mean, if there's no cure, why should I do surgery?
Yeah.
And the basic goal of the surgery is, of course, we try to contain the progression by not making it worse. It's simple. If you keep on putting water in a balloon, it will burst at some point.
Yeah.
But if you put water and then we're able to put some holes in the balloon, then it will leak. At least it will not get worse. And that's the main goal of surgery, in hopes that it will help you delay in the progression. And in this process, sometimes we are lucky enough to actually see improvement of the symptoms. Now we know enough and we have skills enough that in 85% of these lymphedema patients and almost 100% of the lipedema patients, we can improve the symptoms. Yeah. We can make the extremities smaller. Yeah. But again, this is in concurrence with good conservative care. So if you choose not to do surgery, then you have to do strong compression lifelong, but still, even with this compression, it will steadily progress.
It will increase.
Yes. And at some point, it will be very, very difficult to have normal daily activities. But with surgery, hopefully we'll be able to minimize the progression and even better the current situation, and the patient will benefit from that. And that's what surgery is all about.
Nice. And yeah, so post-surgery, I always tell my patients that I need compression. And I remember during our discussions before, a good example is the balloon. And if you create a hole in this balloon and the balloon is filled with water and then you squeeze it, it will empty the water faster. So this is translated into a pure physiology. Maintaining compression post-op is important.
Absolutely.
But what kind of compression? What is the degree of compression? That's the thing different. And usually I tell my patient that post-op I maintain compression so it will keep my anastomosis working longer. So What about like your explanation to the patient?
Right. So the way lymphedema physiologic surgery works is that you have a blocked lymphatic system, and in order for this fluid to exit and drain, you have to connect it to something. And in this case, we connect the lymphatics to the vein, so the high pressure lymphatics drains to the low pressure vein. And this is why we call it lymphovenous anastomosis. Now, by squeezing the balloon, you make the pressure higher and the water squirts out better.
Yeah.
So the compression, when you compress after surgery, it makes the drain faster, and it keeps the anastomosis open. And this is why compression is so important. But this is also based on science. It's not just any compression, it's compression of 30 to 40 millimeter mercury. And this is why in the beginning, the compression is high. And when you lose volume, the amount of compression could be reduced. So if you're wearing class 3 compression, then if the symptom improves, you'll be going to class 1 compression. But nevertheless, you will be doing some type of compression.
Yeah.
Now, in terms of compression, unfortunately, if you come very late, especially in stage 3, stage 2, there's a very high chance that you have to wear at least some type of compression. It may not be high, but some type of compression lifelong.
Yeah.
But if you come early enough, there is a very high chance that you will completely stop compression and will not need any conservative therapy after successful surgery.
Yeah.
And this is why early diagnosis, early referral, early surgical management actually gives you the best chance in recovering fully. But again, remember, even if you reach that point, you always have to be vigilant, because there's always a high chance of recurrence due to many factors.
That's really nice. Maybe a couple of questions, and then lymphedema surgery is not one shot and that's it.
No.
Maybe we need to come back again, and we need to come back again. So it's a lifelong journey. Sometimes when we do the mapping, we find only one linear, and then we connect on it. After 1 year, this amount of fluid in the limb will decrease, and then you will see another line of lymphatics, and then you might need to reconnect on that. So it's a lifelong journey, and then this is, I always really explain it to the patient. So what about you?
Right. So in the past, we said, okay, physiologic surgery is an answer for all. Like if you have stomach cancer, you cut the stomach and it's finished. But unfortunately, lymphedema, lipedema is not like that. It really depends on how much progression you made. It really depends on the stage at where you are. It depends on your body, your body condition. So every surgery is different.
Yeah.
And the sequence of the surgery could be different. If you come early enough, then maybe you're lucky just to do a bypass surgery, so lymphovenous shunting, just once and you'll get better. That sometimes is true. But if you're more progressed, then you need to do this kind of physiologic surgery. In addition, you need to remove the scars in the leg as well. And this may be not only once, twice, 3 times. And even after you remove the scars, then your lymphatics could regenerate. Yeah. And then after a couple of years, then we may do physiologic surgery again. And this is why it's a lifelong journey. It depends on what your state of the disease is at, and we have to design accordingly. And remember, our goal is to have the best possible result.
Yeah.
And in order to have that, it's not one surgery, it's a lifelong progress, and it could be multiple surgeries.
Yeah, exactly. And you touched base on not only the physiologic, which is the shunt, you also touched base on the debulking. Sometimes the shunt will not decrease the size of the limb because it's already fibrotic. It's stiff, so we need to add an additional surgery like the liposuction or the fibrosis removal. And sometimes you need to do another sessions later on. And some patients, they are really lucky and this is one important point I want to focus on, that the lymphatic can regenerate,
Yes.
or at least what was masked by the leak, by the fluid, it will appear after the decompression or the removal of the fibrosis. So I think this is one of the beauty of having this dynamic relationship.
Absolutely.
With the patient, and then coming and going. So
Absolutely.
it's a lifelong journey. It's
Yes.
not like one shot and that's it.
Yes, and you're so right, because the disease state changes over time. You need to do ICG multiple times, for example. You need to do ultrasound multiple times. You need to do lymph scintigraphy multiple times, because after surgery, your body changes, your lymphedema changes, your lipedema changes, and then you have to know the state again.
Yeah.
And then after that, you design another surgery, or you design conservative care, and after a while, you follow up again.
Yeah.
So I think it's very important. And going back, you know, if you have lymphedema now, touch your arm or touch your leg. Some part will be soft, and some part, if you push, you'll see it just depresses.
Yeah.
And some part will be stiff hard. And this is because some part, when there's prolonged fluid accumulation, it turns into fibrosis. So it basically turns into scar. And that part is not addressable by the shunting, because the shunting is a procedure to reduce the fluid accumulation in your extremity.
Yeah.
And once you have the scar, you have to remove the scar by physical surgery, which we call debulking surgery. And this is why it's important to design your surgery accordingly. And then also remember multiple stages, and ultimately trying to reach the goal.
Thank you so much. I mean, it's really enlightful, and I think I don't know. We spent 1 hour talking about this topic. The questions will never end, and always you say we still, although we know many things, we don't know. Many questions comes in, and many questions are still to be answered. So thank you for your time. Again, we are really lucky to have you here in Riyadh, enlightening and sharing your wisdom and knowledge. Started by the course, reflecting to the patients. So thank you so much, and really it's a pleasure and honor to have you here.
Well, thank you. It's been an honor. It's been fun working at the Al Faqih Hospital.
Thanks.
In the Sami Plastic Surgery Center with you. This is a new journey. For those who don't know about this center, I would say that this is the only professional center that addresses lymphedema and lipedema in the private sector. So please make your referral to Dr. Faris and see if you have the right diagnosis, see what he can do for you. And remember that you know, the services here may provide a solution to you, but if it doesn't, I'm here as well, supporting my long life friend, Dr. Faris, and we promise we will help you together to address your problems. But remember, the most important thing is your will to overcome this disease.
Thank you so much.
Thank you, Faris. Okay,
Pleasure.
great. Thank
Thanks a
you.
lot.
Thank you.